The 4th annual UCSF Digital Health Awards seeks to find the most impactful and disruptive digital health companies. Out of the 1,000 plus submissions, only a select few have become quarter-finalists.
My name is Kobis. I work with Syllable. It's a team of people dedicated to improving the patient experience in healthcare, and we predominantly work with health systems. We're a company that has developed software that contains AI that identifies issues with the patient experience and promotes automation within a health system. We've actually built something called listening mode, which enables our AI to listen to what the patient is saying and what their experience is when they talk to a doctor or a nurse or an administrative staff member. And we can use the AI to point out issues in the patient journey. 88% of consumers in healthcare, patients, use the phone to get something done. Even if they started on a digital domain, ultimately they have to switch to the phone to get their transaction or request completed. This is a significant impact on the patient experience. The phone is not always available, and the phone is also a really bad medium to exchange healthcare information over. In fact, in the states that we operate, we routinely see the phone not answered 15 to 30% of all calls, and it takes 3 to 4 calls for a patient before they can service their request to get something completed. And 40 to 60% of all calls are not resolved. Appointments are unnecessarily cumbersome. Any call about scheduling, whether it's cancel and confirm or even something really simple as practice information, takes 9 minutes. And for a new patient to schedule an in-person visit, on average it takes 27 minutes. According to the CDC, there are 860 million office visits per year in the United States. If we take 9 minutes per call on average, that means we spend 27 million days scheduling appointments, and that's only the burden on the health system side. What about the economic burden on the people who are trying to schedule appointments? So it's actually double, and the success rate is not great, 45%. So if we take $15 per hour as the direct labor cost, that's over $6 billion that's being spent on scheduling an appointment. Let's fix this together.
Hi everyone, I'm Dave Kurguntla, co-founder and CEO of Aleo. Aleo is empowering dialysis patients to live with peace of mind. And what that means for the over 4 million patients that live with this each and every day is that it has become a very burdensome and costly experience. Here in the US, despite being 1% of the overall Medicare population, it's almost 10% of the overall Medicare cost. And that results because of preventable complications, including fluid overload, i.e. heart failure, that results in almost 2 weeks a year in ICU per patient. Aleo is an end-to-end remote patient monitoring platform. It starts off with a non-invasive that is worn by the patient. They go about living their lives without any intervention from the patient. It's picking up some raw data from their vascular access, and then it is transformed from raw data into clinically actionable data on some of the key metrics that clinicians already use to monitor those patients today. It's not just about the technology, it's about being able to address the limitations of dialysis patient management today with a product that is easy to deploy and distribute in terms of a box that is handed to the patient. It's easy to use out of the box. So leveraging our AI capabilities to transform remote patient monitoring is an amazing opportunity for Aleo to be an amazing company in the future.
Hear in their own words why they should win.
To date, even though we're federally mandated to take maybe monthly blood draws, we know that can help keep patients out of the hospital. That's like only getting maybe one snapshot a decade for an entire century, as opposed to a video of the course of events to help us understand what happened, when we could intervene, and be more predictive for the next century moving ahead. Leo is an end-to-end remote patient monitoring platform. It starts off with a non-invasive that is worn by the patient. They go about living their lives without any intervention from the patient. It's picking up some raw data from their vascular access, and then it is being able to be transformed from raw data into clinically actionable data on some of the key metrics that clinicians already use to monitor those patients today. So they've got an international set of guidelines. We're just leveraging that to be put into that video rather than just that snapshot once a month. There's so much that really enabled us to serve as a launch pad for where Leo is today. And it's been really exciting to be a part of that. When people reference Kidney X, it's always with, you must be an innovative company. And that's really exciting to be.
We're working to protect as many beats as possible. We need to look closer to see a better way. Current methods do not adequately personalize risk, and treatment is focused on care after symptoms emerge or a heart attack has occurred. At Clearly, we've spent more than a decade performing some of the largest clinical trials to identify the most important indicators beyond symptoms that increase a person's risk of heart attack. What we've discovered has led to innovation, a promising way to identify heart attacks before they happen. Our AI-powered technology analyzes detailed images of the heart to deliver comprehensive and trackable insights about the presence, type, and amount of plaque in the heart. All this adds up to a greater understanding of your heart disease risk and likelihood of a future cardiac event, empowering physicians to create a personalized care pathway that will transform their patients' heart health.
Hear in their own words why they should win.
Well, thanks so much for taking the time to learn a little bit about our company. As a matter of introduction, I'm Jim Min. I'm the CEO and the founder of a company called Clearly. And Clearly is a digital healthcare company that really aims to do earliest and most personalized identification of patients at risk of heart attacks. When we started Clearly, our goal was really to develop a care management platform for evaluation, education, implementation, staging, treatment, and tracking of heart disease. We really never intended to become an AI company, but we recognized that the best-in-class algorithms were AI-enabled, and we leveraged those to really improve our understanding of a personalized examination of patients' hearts. The Clearly digital care pathway is really a multi-step process that starts with non-invasive imaging using coronary CT angiograms, where our software now enables whole heart phenotyping of actual heart disease. If you think about it, over the last 70 years, heart doctors have actually never measured heart disease directly. Instead, we've become very good at looking at indirect either consequences of disease or surrogate markers of disease, not the disease itself. Our company focuses on heart disease directly, which is the atherosclerotic process, or the plaque that builds up within the walls of the heart artery silently over many decades in most people, and places them at risk of heart attacks, but they don't understand that risk because they don't feel any symptoms, they don't have any abnormal tests, and so we really want to get those people early. We believe that the Clearly digital care pathway really covers the entire continuum of patients at risk, from very early stages of disease where we can prevent the disease from progressing easily, to very late stages of disease when patients may become symptomatic. As a team, we're trying to tackle the world's #1 public health epidemic, which is death due to myocardial infarction or heart attacks. And we truly believe that a personalized and standardized approach will be the most successful and overall reduce the total cost of care to the healthcare system.
Patient data is stored in many different systems and servers. The resulting data fragmentation creates an incomplete view for everyone. This leads to inflated costs and compromised outcomes. Rising patient expectations and increasing regulatory demands add to the challenge. We understand, and we are reducing complexity with what we call healthcare in a box. Aggregation, automation, and AI all come together seamlessly, empowering data and transforming workflows. Our custom applications top off the industry's most progressive platform. Healthcare in a box. There's a lot inside, but it greatly simplifies decision-making and accessibility for patients, providers, and payers.
Hear in their own words why they should win.
Hi, my name is Sahar Arshid, and I'm the co-founder and chief operating officer of CloudMedX. At CloudMedX, we've built healthcare in a box that automates workflows and simplifies decision-making for patients, providers, and payers. The problem is that the patient data is stored in many different silos. This makes it challenging for anyone in healthcare to have a complete view, which leads to higher costs and compromised outcomes. On the cost, there are avoidable costs of $760 billion annually. The industry is very manual driven with an administrative overhead of 30%. And on top of that, there's a lot of regulatory pressure. There is interoperability requirements, data compliance requirements, and value-based care requirements. On the other hand, consumers are demanding for timely and hyper-personalized insights. They're looking for the same kind of experience that they're used to in other industries. And there's a huge data explosion. There are 8.41 petabytes of data generated annually, and it's growing at a very fast pace. And this huge data is again in different silos. The solutions that we have today are also very, very fragmented, and they're point solutions. That is, they're focused on one condition or one use case, which makes it very difficult for healthcare organizations to manage all these different vendors, and it adds to their administrative burden. So our answer to this is healthcare in a box. We aggregate silo data into a single unified data platform with a powerful suite of applications and APIs that offer operational, clinical, and financial insights. So this one platform has aggregation, automation, and AI all in one platform.
After acquiring a full standard echo exam of 40 to 60 views, LVivo Seamless runs behind the scenes to select the optimal cardiac ultrasound views and generate automated measurements of cardiac indications, such as ejection fraction and strain. The selected views with results are automatically presented on any radiology image viewer as a secondary capture, alongside a structured report on each EchoLab cardiac exam. If the user would like to manually adjust the borders tracing or change the views, activating LVivo Seamless Workstation for advanced analysis will provide the option to manually edit the tracing borders. The new borders and results will be saved as the new structured report in a fast, accurate, and objective way. LVivo Seamless empower ultrasound users with AI.
Hear in their own words why they should win.
My name is Ila, and I'm the CEO and co-founder of DA Imaging Analysis, a leading global provider of AI-based ultrasound imaging software. We are leveraging AI to automate the way physicians analyze ultrasound images. Our deep know-how and years of experience in ultrasound AI space, together with strong management led by women founders, got DIA where it is today. A market leader in the ultrasound AI software space with thousands of end users, 8 FDA and CE approved solutions, and tens of commercial partners including GE, Philips, Change Healthcare, among others. Capturing and evaluating ultrasound images is still mostly done manually or visually, making it time-consuming, error-prone, and highly dependent on the user individual experience. DIA automate these processes, offering an AI-based technology that imitates the way the human eye detects borders and identify motion, allowing clinicians with various levels of experience to capture the right ultrasound images and automatically identify clinical abnormalities that otherwise are difficult to find visually. We recently released our 8th FDA-approved AI software, Vivo Seamless, which enables cardiac ultrasound users to analyze ultrasound images scanned by any device with increased speed, efficiency, and accuracy. Vivo Seamless runs behind the scenes and on all cardiac ultrasound exams and automatically generate key clinical measurements that would otherwise not be accessible to all patients. Using AI-based ultrasound software is becoming an essential instrument in ultrasound users' toolbox, and DIA proven record is leading the way, with several regulatory approvals and successful commercial traction that no other startup has achieved to date. Vote for DIA.
Immunize end-to-end platform that provides granular, reproducible immunological insights at scale to help detect, diagnose, and accelerate drug development through a comprehensive understanding of the immune system. Immunize platform identifies rare cell types and decouples complex cell states to correlate immune surrogate endpoints with clinical endpoints. Following our expertly designed protocols, we start with biological samples and process them in different configurations of sample and library preparation to generate single-cell sequencing data. The generated data is then processed through a fully automated computational pipeline powered by our machine learning algorithms to harmonize, annotate, and interpret the single-cell sequencing data. Immunize, decoding the immune system to improve health.
Hear in their own words why they should win.
How do we bridge the gap between animal biology and human biology? At Immunize, we believe that the answer lies within the immune system. In the past 4 years, we've been fully mapping the human immune system by combining the power of single-cell technologies, allowing you to measure tissue at a single-cell resolution, together with big data infrastructure and data mining and machine learning. And together, we have a vertically integrated platform that allows you to do immune profiling and functional genomic to go from correlation to causation. There are 2 core pillars of the platform. The first one, AMICA, the database, standing for Annotated Multi-Omic Immune Cell Atlas, is the largest clinical genomic database for measuring the human immune system. And the second aspect is the preclinical in vitro and in vivo systems that allow us to recapitulate the human biology. How do we combine the two? By leveraging engineering-first and computational models to mine the database coming from the clinical samples and the preclinical models. By analyzing it and applying causal inference, we can try to understand how, if, and when patients are going to respond to certain therapies by analyzing them earlier preclinically. This is a very ambitious goal, and the only way to get there is by generating more and more robust and granular data. What is special about our computational models, about our machine learning and AI? The answer is that we have a differentiated engineering-first platform. The database that I mentioned has tens of thousands of samples coming from both clinical patients in the clinic and animal models. Building the tools to integrate large data sets, harmonize the data, reduce the batch effects, even before you start applying more sophisticated data mining tools, is the key to getting more actionable insights. The future of drug discovery, drug development, and diagnostics lies in the ability to create vertically integrated platforms that will combine engineering capabilities together with experimental immunology, biology, and chemistry.
in their own words why they should win.
I think there's three things that I believe really makes Komodo special. The first one is the mission. The mission of reducing the global burden of disease is really what attracts hundreds and hopefully in the future thousands of dragons to come work with us on something very, very difficult and something very, very important. I think the second thing here is the very unique approach we've taken to addressing our mission, to addressing this important undertaking is our full stack approach. It had never been done before. It's very, very difficult, and it starts with the underlying data and goes all the way through the entirety of the stack up to our enterprise workflow applications. And so that's an important differentiator. And then I think most importantly is all of our dragons. They're what makes Komodo special, and they're what make it easy, I believe, for everyone to get excited about coming to work every day and working with so many other talented dragons.
So every customer that licenses Komodo software is doing it in service of a population, which is such an incredible opportunity to actually make a difference in patients' lives. And if we think about a use case from a life sciences company, developing a clinical trial that, for a life-saving drug, all the way to a risk-bearing entity that's really trying to understand the risk of their population, the use of Komodo software is improving that population's outcomes. And so if we think about the next 3 years, well, we're already seeing it today. We're identifying disease earlier. We're identifying areas of unmet need where treatment has to be delivered. We're identifying patients who are at higher risk than normally the data would predict. And that allows us to actually intervene, or allows our customers to really intervene to improve those patients' outcomes. And so we're already seeing that today, and we expect that to continue as Komodo continues to scale.
Enrolling in a clinical trial can be an important option for cancer patients. For some patients, it may provide the best treatment choice. But it's not easy for cancer patients to be aware of all their options as they decide on their plan of care. Introducing Massive Bio. Massive Bio was created to bridge the gap between oncology patients and the investigational therapy options available to them. We are here to help. All the patients need to do is provide their unique cancer history. Our team of clinicians and state-of-the-art artificial intelligence platform will do the rest. Provide us with your contact information, and one of our patient advocates will contact you.
Hear in their own words why they should win.
Massive Bio was founded following the diagnosis in our families of cancer and finding it difficult to navigate different treatment options. And we believe in the mission that every patient, no matter where they are, should have a readily available number of options ahead of them, most likely clinical trials, which is where innovation is driving the new drugs and new breakthroughs in cancer care. So Massive Bio is an artificial intelligence platform that connects patients and their treated oncologists with clinical trials at a fingertip. We have developed a best-in-class solution, which is mobile ready, and also through websites where they can get access to all the clinical trials available in a very deep personalized form, in taking into account multiple parameters, including all the active clinical trials at a given time, all the treatment options the patient has, including the biomarkers, the genomics, even the challenges, such as, for example, logistical challenges, are all into account to the algorithms. So every single patient, no matter where they are around the globe, can access all those options in real time. So what is our superpower? Our superpower, first of all, is having a group of founders that is extremely passionate about the cause. This is a very personal thing. For my case, I'm doing it on behalf of my brother. We also are using a good combination of technology, clinical knowledge, and also operations to make sure that nothing happens in a vacuum, that everything that we do is ready to be actionable at the point of the queries. And we have been able to reach 12 markets across the world. We are continuing to expand globally. And what we really wish for is to make sure that this technology is made aware and available. We do it completely free for patients and for providers. And the idea is to make sure that everyone gets this opportunity at every point when the cancer is being diagnosed or even beyond that.
Cervical cancer is the fourth most common cancer in women worldwide, with over 300,000 women dying from it each year. These deaths could have been easily prevented by timely screening. In the evolving world of cervical cancer screening, mobile ODT is creating a new paradigm with EVA, a digital mobile colposcope powered by novel technology of artificial intelligence. Sold in over 20 countries worldwide and over 180,000 exams performed to date. The EVA device is a compact and portable colposcope, offering a superior visualization and image quality, which is enhanced by a proprietary filter application and image-guided function, all seamlessly performed with non-touch technology. In addition, our unique documentation and storage solutions offer full electronic medical record capabilities, allowing the clinicians to access stored data and images anywhere, anytime.
Hear in their own words why they should win.
Hi, my name is Leon Boston, and I'm the CEO of Mobile ODT. Mobile ODT is a fintech company based in Israel. We're making an impact in the world of cervical cancer. Cervical cancer is the fourth most common cancer for women worldwide, and over 300,000 women die of cervical cancer. We've developed a digital colposcope which is powered by artificial intelligence. And this artificial intelligence allows us to perform cervical cancer screening at an unprecedented scale without the necessity of a specialist. We're also introducing our thermocoagulation technology, which allows us to offer a screen and treat or a single sitting program. Our superpower is our AI. Artificial intelligence in the world of cervical cancer is the game changer. From a competition point of view, our artificial intelligence sets us apart from the competition. We are the only company with a clinically validated artificial intelligence in the world of cervical cancer. Our technology has saved thousands of lives of women worldwide. We have the potential to make a major impact in the world of women's health.
Leading an OR is challenging. On one hand, you have surgeons who are constantly requesting more OR access, and you're worried they're taking their cases to your competitors. On the other hand, you have surgeons who are only using a portion of the block time they've been allocated. And unfortunately, when block time is released back to the OR, it's often at the last minute, which forces your team to scramble to fill the time with any available case. Meanwhile, you're facing corporate pressures to not just grow the overall business, but to grow strategically important service lines as well. On top of all this, your team is burned out. How can you possibly balance all of these competing priorities? The Juventus Perioperative solution addresses these challenges using modern innovations in artificial intelligence, machine learning, and behavioral science.
Hear in their own words why they should win.
The Juventus Perioperative solution is an AI-powered automation solution that enables health systems to improve OR access and grow surgical revenue. The problem in the market today is that ORs suffer from a supply-demand mismatch because of the manual processes and tools used for scheduling. On the one hand, surgeons can't get access, patients experience long waits for procedures, yet if you see expensive operating rooms and surgical robots, they sit unutilized, often 30 to 50% of the time. This problem is incredibly important in today's world. Health systems are plagued by staffing shortages, rising costs, and falling margins, and it's just not sustainable. To address these issues, health systems are looking to grow surgical revenues so that they can continue to provide other services that may be not financially viable on their own. To solve this problem, we use machine learning to unlock the OR time and robot time that'll go unused, which creates more OR capacity. Then our artificial intelligence automatically reaches out to surgeons based on their preferences and health system strategic goals to make sure that that time is filled at almost twice the rate that that time is filled otherwise. We also combine EHR and market competitive data to drive insights into referral patterns and leakage patterns that enables hospitals and health systems to grow their market share. As a result of this solution, our partners are adding over 2 cases per operating room per month, increasing lead time of when the blocks are released to about 21 days and doing nearly almost 50% more robotic cases on the existing capital equipment than before. And in a time when many health systems are being forced to close their ORs due to staffing shortages, our partners have been actually able to add 7% more cases despite having to close 20% of their rooms. All of this translates to millions of dollars of additional revenue per year and happier patients and happier surgeons.
Hi, I'm Jeff, co-founder of RadAI. RadAI Omni automatically generates the impressions of radiology reports customized to each individual radiologist's language and style. This saves radiologists 1 hour per 9-hour shift while reducing radiologist fatigue and burnout and increasing the accuracy of reports. We integrate into all major voice recognition products in the market and work right out of the box without any on-prem servers or VMs. It's a zero-click solution with no changes to the radiologist's workflow. It generates the radiologist's exact language and style because it's pre-trained on all their historical reports and on over 160 million reports overall. It also automatically generates follow-up recommendations based on national consensus guidelines, making reports more consistent and helping make sure that patients receive appropriate follow-up. We work with over 50 radiology practices, including 8 of the 10 largest radiology practices in the US. Many of the largest practices have expanded RadAI Omni to all their radiologists. Over the past year, RadAI was awarded Best New Radiology Vendor by Aunt Minnie and named to the Digital Health 150 and AI 100 by CB Insights as one of the most promising AI companies in the world.
Hear in their own words why they should win.
I'm an ER MSK radiologist who started really young, college at age 13, medical school at age 16, became the second youngest doctor on record in the US, and practiced for over 10 years. RadAI Omni automatically generates the impressions of radiology reports customized to each individual radiologist's language and style. We work with over 50 radiology groups, including 8 of the 10 largest private practices in the US. We save radiologists a median of 1 hour per 9-hour shift while reducing burnout and improving the accuracy of reports. RadAI Continuity automates follow-up care coordination for significant incidental findings. We work with health systems to ensure patients get their necessary follow-up, automating communication, tracking, exam ordering, scheduling, and closing the loop. This helps make sure that patients don't slip through the cracks, reduces health system liability, and generates new value for health systems. RadAI is growing rapidly and has tripled in revenue and customer traction over the past 9 months. This past year, we've been named as Best New Radiology Vendor by Aunt Minnie and named to both the Digital Health 150 and the AI 100 by CB Insights as one of the most promising private AI companies in the world. What's our superpower? RadAI Omni is the only AI solution on the market that reduces radiologist burnout by directly impacting the radiologist's most tangible product, the report itself. RadAI has by far the largest dataset of radiology reports among startups at over 160 million reports, which makes the accuracy of the product difficult to match. There are no competitors for Omni. It's designed and built specifically by radiologists for radiologists and embeds seamlessly into existing workflow as a zero-click solution. A radiologist leader at one of the largest practices in the country noted, "When we deployed a smart triage solution named Best in Class, it took our radiologists about a year to get used to the product. For RadAI Omni, it took most radiologists a day." RadAI continues to improve rapidly. It's become 3 to 4 times as fast since launch. Our features continue to expand, and we respond rapidly to radiologist feedback, ensuring a highly positive customer experience.
in their own words why they should win.
I'm Dr. Greg Albers, co-founder of Rapid AI. Our company provides healthcare professionals with AI-powered software tools to diagnose and treat neurologic and vascular disorders. We founded Rapid AI over a decade ago with a mission to transform the way healthcare is delivered. When a patient presents with a time-critical emergency, such as a stroke, doctors need immediate access to key data to facilitate an optimal treatment decision. The Rapid mobile app provides images that show how much brain tissue is still salvageable, along with clinical and vascular imaging data that can help determine which therapeutic option is the most appropriate. Our biggest superpower is that we have X-ray vision. We first gain a deep understanding of how a disease process evolves over time, which allows us to determine which patients are most likely to benefit from a therapeutic intervention. Then we design an imaging analysis solution that will have a major impact on patient outcomes. For example, before 2018, stroke treatment was restricted to patients who could be treated within 6 hours of symptom onset. Then we completed 2 clinical trials that demonstrated that patients with salvageable tissue, as identified by the Rapid platform, could have huge treatment benefits even when the treatment was initiated as long as 24 hours after symptom onset. These findings immediately changed international guidelines and increased the treatment window for stroke by a factor of 4. This breakthrough has already reduced death and disability in thousands of stroke patients. Today, our advanced AI imaging and care coordination platform is being used in more than 2,000 hospitals and in over 100 countries. Rapid's been tested in more than 25 clinical trials, with 7 of these published in the New England Journal. We've expanded into several other disease states, including pulmonary embolism and the detection and tracking of cerebral aneurysms, making Rapid the most comprehensive AI platform.
It starts with a breakthrough in calibration technology called the Swift Helix. This scientifically engineered marker is the only one that is FDA registered and made of biocompatible materials to avoid skin irritation. With Swift, wound measurement is simple. Take a photo and the wound is identified automatically in real time. Swift is the only solution that offers 3D auto-depth measurement without the need to purchase additional hardware. Wave your device over the wound and it captures a detailed 3D impression, providing the most accurate depth assessment possible. Swift also makes it easy to track wound healing over time by collecting a comprehensive dataset which can be customized and made mandatory for compliance.
Hear in their own words why they should win.
There are more people with a chronic wound than with breast cancer, colon cancer, lung cancer, and leukemia combined. We think it's a special problem that needs to be solved, and we believe that we're the company that's going to do it.
The technology advances that we are making are impacting human lives.
When we say we have the ability to transform healthcare, we're not just saying it, but we're making sure that it actually happens.
Typically, you'll measure the wound with a paper ruler. In that type of measurement, on average, you'll have over 45% error from one clinician to the next. Our technology allows those measurements to change from 45% error to over 90% accuracy.
If you can reduce your uncertainty and improve your accuracy in those measurements, it becomes possible to make a much earlier decision on whether your treatments are being effective or your treatments are ineffective.
Wounds are prevalent across every single segment of care. And the stats are astonishing. 1/3 of home health patients have a wound. 1/4 of all patients entering a long-term care or skilled nursing facility develop some wound that they see over their lifetime.
The little things that we do day to day are helping the healthcare professionals that we have the pleasure of calling our customers. The real motivator for me is when I go home, I get to feel good about what I did at work.
We do work really hard, and we are unabashed about that. We think that changing the world is not an easy task, and we do that every day, and we must do the best job that we possibly can.
Join us on November 14th for our grand finale at Health in Las Vegas to see the winners crowned.